Hello, and welcome to Dr. B Talks About Hearing Loss with me, John Burgoyne, a practicing otolaryngologist in Austin, Texas, with over 30 years experience in dealing with patients who have hearing loss. And today we're going to talk about what hearing loss is and the types of hearing loss that we see, so that patients who are experiencing hearing loss can have a better idea of what they're experiencing. There are two main categories of hearing loss that we talk about as physicians, and also audiologists and other people like that. The first is what's called a conductive hearing loss, and we'll talk about what that means in a moment here. And the other one is called a sensorineural hearing loss. So to understand these types of hearing loss, we have to look at the ear just a little bit. So this is the ear. Sound comes in, as we know. That vibrates the eardrum, which vibrates these little bones. This last little bone kind of vibrates in and out like a piston. And this thing called the cochlea, which means snail shell, has fluid inside it. And this vibrates the fluid inside there. The sound is picked up and sent along the nerve. And of course, that's not the end of it. It has to get to the brain, to this part of the brain where we pick up the hearing on the hearing cortex. So if we are looking at this, then we have to say, well, why do we have two different kinds of hearing loss? So when the sound comes in and does this vibration and is transported into this point here, we call this the conducting apparatus, because that's just conducting the sound to this part, which senses and then takes it through the nerve. So anything over here we call a conductive hearing loss, and over here it's called a sensorineural hearing loss. This is the sensation, and that's the nerve. So conductive, sensorineural. We're going to talk about conductive hearing loss first. So in a conductive hearing loss, something is blocking the sound. Something is making it so it is not able to be conducted through that system. So that can be a lot of different things. It could be earwax blocking the canal so the sound can't get through. It could be your finger in the ear or an earplug. Those all give you a conductive type hearing loss. It could be because the ear canal didn't finish forming and that there's a solid wall of bone there that's blocking the sound from getting through. So this is a congenital blockage. It could be because the middle ear is full of fluid and the eardrum can't vibrate normally. This happens in ear infections, for example. It could be because there's a growth, like a skin cyst up in the ear that's blocking the little bones from moving properly. In some fashion, though, the conductive system is broken. It's a broken problem. The inner ear here is fine with just a conductive loss, but the sound conducting system is broken. So other things that can cause that are a hole in the eardrum, because if there's a hole in the eardrum, it doesn't move properly. It can be because there's a disruption in the little bones. So again, here's the normal with the bone there and a hole, and then here it is without that little bone. And then there's another situation where there's a deposit of calcium around the little last bone, so it can't do its piston vibration mode. So conductive hearing losses they're due to a mechanical problem. The inner ear is fine, the brain's fine, but there's a mechanical problem. In principle, these can all be fixed. You can take the wax out, you can fix the hole in the eardrum, you can replace the little bones that are there, you can even replace the little bone that doesn't move properly. So in principle, these can be fixed either medically or surgically. And generally speaking, hearing aids work great if this is the only problem. All you need to do is make the sound louder and it does really well. So hearing aids work great for these patients. On the sensorineural part, though, it's a little bit different. So sensorineural hearing loss means that there's a nervous system problem. And so here we are again, just to remind you, the sound has to be picked up in this cochlea, this snail shell, and inside, if we magnify it bigger and bigger and bigger, there is little things called hair cells. And these are in the fluid there, and they vibrate with the fluid, and that takes the signal and puts it into these nerves, and all those nerves join together and head off to the brain. So when we have sensorineural hearing loss, there's frequently hair cell damage. That can just be due to aging. All of us, when we were made as embryos, we were fetuses, like 5 weeks along, our inner ears started to be formed. And we had like twice as many of these hair cells as you need to have absolutely perfect hearing. And then it's all downhill from there. Typically, people don't have enough hair cell loss until they get into their 20s before you have a measurable change in the hearing, but they continue to die off. And everybody, if they live long enough, will have some hearing loss, but there are certainly people whose hair cells survive longer, and so they can be in their 90s and still have reasonably good hearing. Noise exposure will make the hair cell loss happen much more quickly. And so if we're exposed to loud noises, we'll lose those hair cells, and it can happen really quickly. Sometimes there'll be a swelling or pressure in the inner ear that will cause the hair cells to not function properly. And there are toxins or drugs which can damage the inner hair cells. You can also have an injury to the nerve of hearing between the inner ear and the brain. That can be like a growth on the nerve. Those are usually benign growths, but they happen actually not too uncommonly. Trauma can also tear the nerve or injure the nerve. In fact, I had a patient just this month who had had a motor accident and had a break right through the nerve and had torn the nerve. Finally, brain injury can cause a problem with the sensorineural system, and this can be like a brain tumor or a stroke. So since the sensorineural hearing loss is a nervous system problem, we may not have a fix for it. Like other things in the nervous system, if you've wrecked your hair cells or wrecked the nerve, sometimes you can't fix that. Hearing aids usually work, but they don't work as well because with the sound detection system messed up, things may not be as clear. They may not be garbled. Sometimes if you have this type of hearing loss, we can use what's called a cochlear implant. And a cochlear implant basically puts sound right into proximity of the nerve detection hair cells and can stimulate the nerves more directly. So remember I said that there are these hair cells in there? Well, a cochlear implant is an array of wire that goes right in there and then ends up right in here, and that directly stimulates the hair cells, or actually the nerve coming away from the hair cells. Now, cochlear implants are awesome. I'm glad we have them, but they don't give sound like a functioning system. So those are the types of hearing loss that we talk about. We have conductive hearing loss, which is a mechanical problem. The sound is not getting to the inner ear. Most of those problems can be fixed surgically or medically, and hearing aids work great. And then we have sensorineural hearing losses, which are a problem with the inner ear itself or the nerve or the brain. Those aren't as easy to fix and sometimes can't be fixed at all, especially like a brain problem. But a cochlear implant can bypass some of that problem and help to stimulate the nerves directly. Well, that's it for this talk. This has been Dr. B Talks About Hearing Loss. Again, my name is John Burgoyne and I'm in the Austin area. Remember, what you see here is not the treatment of disease. This is not the practice of medicine. Don't think that you can understand everything about your problem by watching YouTube videos. If you have a problem, come see a doctor. And as I say, if you're in Austin, come see me. Just Google me. You can find me. Thanks for listening. Before you go, make sure and press the buttons to share, like, and subscribe to the channel, and check out the other videos that we have. Thanks.